Good morning, everyone. Welcome to Sun Up on 7. It's Wellness Wednesday here, and of course, we're going to be starting our conversation talking about COVID, the increase in number of cases that has been observed by the Ministry of Health and Wellness, and the Pfizer booster that is available. And of course, it's hot, and we gotta get booster, get that shot ready. So to join us on this conversation, we have Dr. Hidalgo, who's an internist and intensivist at Belize Healthcare Partners, and Dr. Natalia Beer, who's joining us via Zoom. She's a technical advisor of the Maternal and Child Health Unit of the Ministry of Health and Wellness. Good morning to you both. Dr. Hidalgo, how are you feeling this morning?
Good, good. Thank you. This is my second show
It's
in a
your
row.
second show in a row.
Back to back, guys. Like, he loves this couch.
He loves this couch.
If he comes tomorrow, then he's gonna get like a dance, and it's probably something special because of that 3 back to back.
Right. Probably get breakfast.
Oh yes.
Yeah?
Probably.
Dr. Bear, thank you for joining us via Zoom. How are you feeling today?
Hi, Kevin. Thanks very much for the invitation and it's a pleasure always to share with you guys.
Great, we love that. Thank you, Dr. Bear, for joining us. So, Ren, let's get started with the conversation.
Yes, definitely. I want to first talk about, the increase in cases, because I know when there was a press release sent out just recently, yesterday.
Yesterday, yeah.
So when I was reading, I was like, oh my, we're having that steady increase.
Oh my.
I was like, no, that was a funny part, because I was like, oh my, we're having a steady increase. And I was like, oh, it's Belize district. I'm like, why I live in a Belize district? I was upset for a minute. But can you talk a little bit about that increase? How are the numbers looking? Because when you hear increase, are we saying like, okay, maybe there's 10 more cases? Is it like a very serious increase? But regardless, I know that you're pushing and encouraging the public to continue washing their hands, wearing their masks when they're outdoors and indoors, and especially in crowds, and trying their best to adhere to the regulations like before. I know we kind of gone away with the mask, so people are kind of know like, I don't need the mask or so forth. But can you talk a little bit about the numbers? I don't know, I guess Dr. Bear?
Dr. Bear, yeah.
Yes. Well, as we said every time we have this opportunity, inviting persons that it's not an issue of numbers, no? But when it comes to the increasing the number of cases, well then, as a function of the epidemiology unit, we definitely have to monitor the amount of cases that are coming out per day for us to make a decision based on the amount of cases. If there is any need to go back to some of the measures that we had in place previously. And yes, the use of face masks have been lifted, but I mean, you have to use your own precaution,
Yeah.
Very true.
If you are in a group where there is no possibility of maintaining physical distance, then you have to decide if you will continue without a mask or use a mask to protect yourself. The virus is here. We know we have the Omicron variant, we have the Delta variant circulating, and those to date continue to be variant of concern.
All right. So there you go, Ren. I mean, COVID is still here.
Although we think that it's not, it's still here. I know people are going back to normalcy, but it's normalcy with caution.
Yeah.
I think that's important.
I think so. One of the important things is that overall, as a population, we have already the fatigue of the COVID. We are already tired to listen the information, and probably we already, as a population, in a whole, we lost track of the different variants and everything. And one of the things is that for the last a little bit more than 6 months, we don't have a new variant, but we still have all the Delta, and we still have the Omicron different sub-variants, no?
Yeah.
And then, of course, the pandemic is not over, no? Even that we would like to, the pandemic is still there.
And that's super important for us to understand, regardless of regulation, because I honestly think the regulations is what kind of caused people to just ease their mind to say, okay, we don't have to wear masks, we don't have to do this. Sometimes people don't even ask you to wash your hands before you go into, or there's some stores that don't even have you spray your hand before. Like, you have to take that on yourself now. It has to be an initiative from yourself.
Yes, sir.
So I think that in itself mentally allows people to say, I can relax and I can take a break, when we shouldn't be taking a break. We should be being mindful. I mean, I'm not saying to just put your life on hold, but be very mindful of how we carry out. And part of that being mindful is the booster shot. I think, again, when the regulations were starting, people were saying, oh, I don't need the booster shot again now because masks to go. And so it's a little free for all kind of thing we're thinking.
Yeah.
So I know the Pfizer booster is out now, and there's an expiration too as well for the ending of this month, if I'm not mistaken.
Yeah, I think so. The importance of the booster, no, as we know, and we talked yesterday about the immune system, no, and we need to create and enhance our immune system. And one of the ways we do that is through the vaccine, and also the vaccine over the time it will wane the effects. We don't know exactly, but it's more or less give you a protection of up to 6 months, probably. I mean that that's the reason why if you have the first and the second Pfizer vaccine, you need the first booster. That we already passed that period. No? Of
Yes.
course, there are some people that still they can still get that third booster, but now what we are promoting is the second booster, and that came basically on the studies that came first from Israel, that they noticed that especially in the vulnerable population, the protection wanes, and then we need to enhance the immunity of that vulnerable population. You know, the second booster is essentially promoted at this time for the frontline workers,
Yeah.
and also for the people 50 and older, and those that have any immunocompromised condition. That means that people that have, like yesterday with lupus. Patients that have
HIV.
getting HIV, treatment for cancer, congestive heart failure, diabetes, among others. No?
Okay. So that is so now officially people that are 50 years and over, they have immunodeficiencies, as well as frontline workers, they are the people specifically that can go out to get the booster, right? The second booster, right?
Second booster.
Yeah, because we have to make sure we know it's the second booster out there, and it's going to be the Pfizer that they're getting.
Exactly.
Yeah. Dr. Bear, can you share with us give us some insight into what's the current vaccination rate like? Because I'm thinking there's a lot of people that have taken for granted that COVID regulations are off, and they might be hesitant and saying, why do I need to get vaccinated now? When Renata and I were reflecting here, and we are where we are now with regulations being removed and that kind of thing, due to the fact that vaccinations have been available, due to the fact that regulations were in place to control and monitor COVID. So can you give us some insight into what's the current data showing for vaccinations? And please, by all means, give us some word encouragement as to why we should get vaccinated.
Okay. Yes, thanks for that question. The why we should get vaccinated is that there is much more to learn from COVID. For example, we thought at the beginning, and I can say the world, we thought that COVID-19 was just one more respiratory infection. But today we know that, up to date, we know that it is a systemic disease. So definitely it is contributing to increase the number of persons with chronic illness due to COVID-19. Not everyone, but we have patients that are presenting these long COVID signs and symptoms. So COVID-19 is one more of the vaccine preventable diseases. And we are still struggling with avoiding the infection. So persons that are vaccinated may get infected, but the value of the vaccine is to protect against severity of the illness and reduce the number of deaths. Of course, we tend to forget that persons may have chronic illness. The vaccines will not confer total protection as with a healthy individual. So we have to consider those factors too. So to date, we have a total of 211,355 persons with their completed primary series of COVID-19 vaccination. That represents 49% of the total population. Remember, the target is 85, so we're a bit far away from that target.
Right.
Among the persons that are 12 years and older that are eligible to receive the vaccine, we have accomplished 68.74%. So, in a nutshell, out of every 3 Belizeans, 2 are vaccinated. So we still have that one there susceptible to the infection and will contribute to the spread of the COVID-19.
Great. Thank you for sharing that information with us, Dr. Bear. And again, we urge people to go ahead and get vaccinated. There has been conversations going around vaccination for children that are between 5 to 11 years. CDC shared some data that's saying that the new variants of Omicron and Delta is being notable within children of this age range. However, at some point there was no vaccination for persons of this age range. What is the current conversation like in Belize when it comes to vaccinations for persons between 5 to 11 years? Is it something that's coming up? Can you give us insight into that?
Well, the government of Belize continue to liaise with countries, seeking access to vaccines for children 5 to 11. CARICOM also have participated in these negotiations. So we are just waiting to see, when we will have access to vaccines for that age group.
Great.
And so with that same vaccine too as well, would there be like an education campaign to help parents? Because I know parents thinking about, the vaccine, they still have their whole skepticalness. They prefer to just send their child with a mask as compared to get the child vaccine, maybe because they've gotten vaccinated and their effects were nothing close to what they wanted it to be. Will there be like an education campaign to help with that process too as well? Because I think 5 to 11, that's an age where children are really still developing a lot too. So people automatically think, is this vaccine going to mess up my child's, developmental process? What's going to happen there,
Yes, well, I think so. That's an important question, and the hesitance of vaccination is nothing new. No, if we go to history, we see that like in the outbreak of the smallpox, we have the same problem, and then it's very unfortunate that history gets to repeat it with all these things. No? But the definitely information is critical. As you see, people with all this negative information and positive information is growing. It's important that we need to understand that, as already mentioned, that the pandemic is not over.
Right.
And then if we all together want to get this pandemic over, one of the most important things is to get vaccinated. And I believe if one of the things is important in children is to get this level of protection. And I think so the campaign also is going to be there to educate on the importance of the vaccine for children.
Definitely. You mentioned something very important, and I know there's been people that have been asking that question too as well. In regards to the term pandemic, especially like people are saying, are we coming to the end of our pandemic? Is the name going to be dashed out soon? Because for the most part, a lot of countries have been able to control it. Belize definitely know we're not perfect, but we have, I would say, decent numbers for our range and our ratio for our population. Is there any talks about, dashing away? I wouldn't say dashing away, but I mean, retiring that phrase pandemic. Is there anything that's happening, any conversation?
We would love to, if we would say, to be close to that stage, but unfortunately, no. As you see in the news, there are some hotspots around the world.
That is true.
And also numbers are still high and increasing lately. One of the things is that the rate of the deaths are decreasing, but we still have a lot of numbers of COVID-19 around the world. And I don't think so we are getting close to that as yet.
So we're still not there yet?
No, to call it an endemic. No, we are not close to that.
Yeah, we're not the endemic phase. We're still in a pandemic. COVID is still all
That's
over the globe.
important to highlight that, we're not, because I think people are in their mind thinking that we're at endemic stage and we're not there. Thank you so much for explaining that, because just because, it happened directly, like we need to say a lot of deaths here at Belize does not mean worldwide that there is not a problem still at hand. And so for people who want to travel, that's something to be mindful of too as well. Not be willing to live your life to the fullest.
Right.
Exactly.
So,
Dr.
cautious.
Hidalgo, Dr. Beer, we thank you so much for joining us in this conversation, reminding our viewers COVID is still here. We all have a role to play in regulating and managing our COVID crisis in the country. Vaccinations are available. The second booster is available for vulnerable populations, so that includes persons with immunocompromised conditions, frontline workers, and persons 50 years and over. So vaccination sites are available countrywide. Please visit them, and again, do your best to control COVID.
Definitely.
Yeah.
If nothing else, please be mindful, not just for yourself, but those that are around you. Guys, I know the mask not there, which this is like it's not mandatory, but if you see a huge area and you see somebody that cough, lot of things, just let's be
On the
mindful.
bus.
Yes, I think sometimes even if you're not walking with your mask, have it in your purse or have it somewhere close by where you can take it out. If you're seeing a crowd come around, at least do that to be cautious when moving forward, because again, we're not in an endemic. We're still in our pandemic. So let's be mindful of that. And again, thank you so much, Dr. Beer, and thank you so much, Dr. Hidalgo.
you.
If you're going to be here tomorrow, remember we have the
We need
whole
to dance.
breakfast thing. So what happened with
Gonna
that?
be dancing tomorrow.
You're going to be dancing and then probably getting your work for your breakfast. You understand? The whole work society. But with that, we go to our next commercial break. When we're back, we're going to be talking about the Belize Brain Awareness Society and what is happening on that scene. Stay tuned for that exciting conversation. We'll be right back.